Hello. Hello, Vedette. Steph, how you doing? Kathleen, I see you. Maiva. No, she would say, no, it's not. That's not how to pronounce my name. Maive. You can't beat me now. I'm on YouTube. Sorry. Donnell, you are going to sleep. Hello, chaperone. Hello. Okay, we don't have much time. How many are we here? 15. Where's everybody now? Sorry. I know I'm always getting your name wrong. Hey, Slayer, how are you doing? Good evening. I know I'm always getting your name wrong. I just don't know why. Sorry. Take heart. Take heart. Okay. Let me send this thing. Hold on, I'm trying to open our stuff for today. I am fine, Steph. How are you? Hello, Vedette. Karen, Christine, I see you. Naya? Naya, I know you see. How you doing? Good evening. Okay, we are up to 20. So actually, some people sent me a message that they want me to take 20 minutes to just go through that urinary system again, especially the most important places. I'm not going through everything. I just want to go through the most important places. I hope you were able to watch the videos and do the review on your own before now. Yeah. I hope you were able to do the review on your own before now, because that will be extremely important to our discussion today. And remember, I told you, everybody here has to answer. All right? You must give me an answer. Very, very important. So before that, let me share. Where is everybody? We are 19 here. Where are they? Where did they run to? Okay. Yeah, just the question. Don't worry. There are some people that mentioned. I'll be very fast. It's just urinary system we are doing tonight. So don't worry. I'll be very, very fast. You understand? It's just that some people texted me and they said that they had one or two confusions in urinary system. So that's why I really want to, just take 20 minutes. I'll take 20 minutes out of our time. Once it's more than 20 minutes, tell me, I will stop. All right. I hope you can see my screen. Can you see my screen? Don't worry, just 20 minutes. Chaperone is ready. Say, Nchebe, pour out the question. Pour out the question. See spirit. I like the spirit. I like the vibe. Yeah. Don't worry. So, urinary system is all about, It's very related to the reproductive system, but it's, majorly, it's something that gets rid of your body waste. Okay, perfect. It gets rid of your body waste. It helps to maintain pressure and other things. All right. We call it genital system when you combine it with the reproductive system, because both of them, they share the same embryonic development and they have the same anatomical relationship. All right. Extremely important that you know that. You need to know this diagram. You need to know the level of the urinary system, especially the kidney in both the left and the right. You need to know the two of them. You must know the function of the kidney. The function is not just to excrete waste, metabolic, blah, blah, blah. Do it quick. I will. I'm okay, Professor. I'm just at work. No, that's fine. That's fine, Steph. Okay, so you understand, it's not just about filtering. It's just about filtering, all right? It's also regulating of blood pressure, regulating of the electrolytes and acid-base balance, secretion of erythropoietin, calcium levels, hormone levels, detoxification, and also production of glucose. All these things are done by the kidney, all right? That's why the kidney is not the dialysis is not direct substitute for kidney. No. That's why if you see people that has kidney dysfunction, thank you. If you see people that have kidney dysfunction, all right, they always require dialysis as a stopgap, not as a treatment. You cannot continue on dialysis forever. Why? Because dialysis only takes care of the most important thing, which is what? Filtration of blood, all right, and excretion of toxic metabolic waste. But what about other functions of the kidney? Dialysis cannot do it. For example, erythropoietin production. What is erythropoietin? It helps to stimulate the production of red blood cells in the bone. So without erythropoietin, you see the person becoming anemic. That's why you see those patients becoming what? Anemic. Extremely important that you know this. All right. So that's why they are deficient. Okay. That's why we must always give them kidney transplants. Must. That's the treatment. Must. Kidney transplants. Why? Because dialysis will not help them to regulate their pressure and osmolarity. Sometimes it can help because it will remove some molecules from their blood, but it cannot help them to secrete erythropoietin. It cannot help them to regulate calcium. It cannot help them to regulate what? Hormones, or to do other things. So that's why it's extremely important. Now, you must know the different wastes. You must know the different wastes, all right, that your body produces. That's metabolic. We call them metabolic waste. That's waste product produced by the body. They will ask you, what is waste product from protein? You tell us urea. Nucleic acid, you tell us uric acid. Creatine phosphate, you tell us what? Creatinine. So there are three major: urea, uric acid, and what? Creatinine. All right. Nitrogen is very terrible. The level of nitrogen waste in the blood can just become so big. If it's more than 20 mg per dl, we call it what? Azotemia. They will ask you, what is azotemia? Azotemia is elevated what? BUN. That's blood urea nitrogen. And what is uremia? What's the difference between uremia and azotemia? Azotemia is when it is high, right? Uremia is now when it is displaying signs and symptoms for you, such as what? Diarrhea, vomiting, dyspnea, and cardiac arrhythmia. What is cardiac arrhythmia? Your heart will be doing, the heart do like this, jing, 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 jing. Suddenly, pim, 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 pim. Do you understand? That's the ECG of the heart. If you look at the ECG, that's arrhythmia, and it kills. All right? As a result of what? Toxicity of the nitrogenous waste. And what do? Hemodialysis as a stopgap, then organ transplants. Very important. So you need to understand this very, very well. These are the nitrogenous waste. You need to know them. You need to know about the excretory organs in the body. I'm not going to talk about it. You need to know about the position of the kidney, right? Position, weight, and size of the kidney. Remember, what we are doing is anatomy and physiology. Anatomy is what? Location, 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 structure, structure, structure. Physiology is what? Function, function, function. So you must know the anatomy, the real position of something, the real structure for you to know the abnormal. You must know the real function for you to know what? The abnormal. Now, talking about the kidney, which is the major thing in the urinary system, talking about the kidney, you need to know that it's this bar soap, right? That's the side of the kidney. So if you do your hand like this, that's the size of the kidney many a times, all right? Now, you need to know the protective coverings of the kidney. We have the renal fascia, we have the perirenal fat capsule, we have the fibrous capsule. They will ask you this question. Now, this is the parenchyma of the kidney. This is everything you need to know in the kidney, all right? This is a hilum. I hope you can see my mouse. Can you see my mouse? Yes? Yes. So this is hilum of the kidney. All this thing is parenchyma divided into two. This is cortex. This is the medulla. All right. You need to know everything in them. Renal parenchyma is just like, what should I use to do example now? What can I do example? Okay. If this is the kidney, and I cut it like this, open it like this, like this, chakom. You understand? All that face is called what? Parenchyma. You need to understand that. And when you talk about sinus is always cavity. And which cavity is that? Usually the cavity that contains blood and lymphatic vessels, nerves, urinary, like everything. All of them goes out through what? The hilum. You know, this is the hilum here. You see? This is the renal artery. This is the renal vein. All right? These are sinuses. In these sinuses, you will see artery, vein, nerve in this particular sinus. You understand? You see another sinus, artery, vein, nerve. You see another sinus here, artery, vein, nerve. But this is what? The artery. This area where they are entering, this door is known as what? Hilum. They will ask you in the exam, depending on the spirit. All right? The spirit will tell them what to ask you. Remember I told you about the zones of the renal parenchyma. If you open the kidney like this, check them. All this area is known as what? Parenchyma. It's divided into two. The outer part is known as what? The cortex. The inner part is known as medulla. You need to know what are in the medulla and what are in the cortex. In the medulla, you are talking about what? Columns. You are talking about pyramids. Very, very important. Then from there, you are talking about what? You are talking about inner calyx, major calyx, minor calyxes, and urethra. You must know the sequence. You must know the sequence because they will ask you. All right. So look at a very good structure. What are you seeing here? Look at this diagram here. This looks like Pyramid of Egypt. That's the pyramid of the renal medulla. Look at it here. I hope you can see my arrow. Can you see my mouse pointer? Say yes. Say yes. I need one person to say yes. See how I'm saying say yes, as if somebody is doing engagement. Say yes, say yes, say yes, say yes. Don't mind me, I play too much. Okay, so this is the inner medulla. You see? This is the pyramid of the medulla. You see how it looks like Pyramid of Egypt. All right? Under there, you see there's something we call papillae, but you are not seeing it on this diagram. But from there, you see the minor calyx. This is the minor calyx. This is another minor calyx. This is another minor calyx. Collecting urine from this medulla, from this pyramid, and pouring it into the major calyx. So minor calyxes collect, you understand, pour into the major calyx. Major calyx goes into the renal pelvis. Renal pelvis becomes what? The urethra. From the urethra to the bladder, from the bladder to urethra, and it comes out. Okay. I don't want to waste time on this. So look at this very, very well. Now you need to, I always discuss this with the diagram. You see this diagram? I told you this diagram has to be your, how do I explain it? This diagram must be your screensaver or your wallpaper before your exam. You must put it in your head. You must be holding it on your phone like this every minute. All right? Because this discusses how the blood flows, right? This is your heart. Blood comes out of your heart with the biggest artery, which is what? The aorta. From the aorta to the renal artery, from renal artery to segmental artery. Look at it. This is the renal artery here. If you can see my mouse, this is the renal artery. From the renal artery, this is segmental artery. From segmental artery, you understand? You go to the interlobar because these areas are the lobes. You go to the interlobar artery. From the interlobar artery, it bends like this. It becomes arcuate artery. Look at the arcuate artery as it bends. Then you see something that's radiating like fire here. Radiating like fire. Radiator. Corona radiator. So look at it. Aorta, renal artery, segmental artery, interlobar, arcuate artery, cortical radiator. Not coronary, cortical rather. Cortical radiator. Then from cortical radiator, it will now enter into the glomerulus of the nephron. All right? That glomerulus of nephron is entering through what? Afferents. I don't know how you pronounce it, but just know that this is A before E. You see? A before E. So A enters the glomerulus and comes out through what? Efferents. Extremely important that you know this thing. Then backwards, you talk about the peritubular capillaries. This is the vasa recta. All right? The vasa recta is usually seen and visible in just a medullary what? Nephron. We'll discuss that later. Then from there, peritubular capillaries, cortical radiator, vein is going backwards. Now it becomes what? Vein. Cortical radiator vein, arcuate vein, interlobar vein, renal vein, and towards to the biggest vein, which is what? The vena cava. And back to the heart, the right atrium of the heart. Do you understand? From there, it crosses and start coming out again from the aorta. and go to the kidney, filter, distribute, and go back to the heart. So extremely important. This is a filtration mechanism, very complex. All right. So that's that. I don't plan to discuss more about that. This is the micro circulation of the kidney. You see, this particular one now, you see this guy is short. This is what the cortical nephron is short, like me. I have my club members here. Somebody is looking at me somehow. You're looking at me somehow. I can see you in your house. Anyway, you understand? It's short. It's in my club that we call it then what? Cortical radiator. All right. They are more numerous. You know, short people are more numerous in this world. I think so. Can check Google. You understand? So cortical radiator, they are short nephron. And they are usually found in the cortex. They are more numerous. They are about 85% of the entire nephron. Is it 85% or 75%? Go make your research. Now, this is just a medullary nephron. You see how it's as long, just at the medullary. Look at it. It's in the cortex, then it's entered the medulla. You see? And it has vasaracta. This one doesn't have vasaracta. Feel me? And this is collecting duct. Mind you, collecting duct is not part of nephron. I will keep saying it. I'll keep shouting it. All right. Now let's talk about the nephron. How many nephrons do we have? 1.2 million nephrons. All right. Composed of two principal parts. We have the renal corpuscle. We have the renal tubule. When we talk about the corpuscle, we are talking about the cup, the corpuscle, the cup. Look at my hand. This is glomerulus. We call it the corpuscle. So from here upwards is the corpuscle. Then this one that goes down like this and goes like this to the collecting duct is called what? The tube. This is how the nephron is. See my fine hand? Eh? I know somebody is looking at this, my hand, and is wow, this hand is so fine. Yes. This is the corpuscle. This is corpuscle rather, the cup. It looks like cup. This is so if they ask you in the exam, you should be able to remember it. Now, what are the areas of the corpuscle? We have the outer parietal, you understand, and the inner what's visceral. You understand? So go look it up. I'm not here to go and explain it more. This is the corpuscle. You see it? I told you, afferent A takes the blood into this thing, just like the intestine. You understand? You see it? The blood keep going. And as blood is going, it's filtering. So this area is the corpuscle. It's now filtering into the tubule. You should remember that. That's why I say it's like a cup. So filtering, the blood is going into circular motion. You see? Look at it. Then it is coming out here. So you remember that E for afferent, and afferent is very big. A for afferent is very big. It's entering. Then E is exiting. E for exiting, and it's very small. Okay? So, okay. So the tubular area is divided into four parts, right? We have the proximal convoluted tubule. You understand? Then we have the nephron loop. Nephron loop has descending and ascending. That's 3. Then we have the distal convoluted. All right? So that's 4. Proximal convoluted, descending nephron loop, ascending nephron loop, and what? Distal convoluted. All right? These are the 4 parts of the nephron. The collecting duct now receives fluid from a lot of what? Nephrons. And collecting duct is not parts. Remember, it's not parts. Okay, the first part is the proximal convoluted tubule, simple cuboidal epithelium, the longest part. Then we have the nephron loop. All right? Then we have the distal convoluted tubule, also cuboidal. Now, this nephron loop has thick segments and what? Thin segments. That thin segment is simple squamous epithelium. That's one place, apart from the alveolus, that is simple squamous epithelium in the body. You can never forget this. Virtually every other place in the nephron is what? Simple cuboidal. Remember, I told you cuboidal cup, it produces what? Fluid. Okay? Okay, now the collecting duct. Then from there, collecting duct enters the papillary. Look at the diagram here. This is what you need to know. The glomerular capsule to the proximal convoluted tubule, to the nephron loop, to the distal convoluted tubule, to the collecting duct, to the papillary duct, to the minor calyx, to the major calyx, to the renal pelvis, to the ureter, to the urinary bladder, and to the what? Urethra. You can never forget this. You understand? I won't waste time looking at it. So this is just a medullary. Okay, it's 15 and 85. I was correct. Cortical is 85, right? It's short. You understand? This guy is just a medullary. Is very long, and it's just 15%. There are only few people, top people in this world. A lot of short people, me and most of you. Somebody is saying I'm not part of their group. This is so good. Okay. So this is innervation. We have sympathetic and we have a parasympathetic. You need to know about it. Secretion of renal. So this is filtration. There are 4 mechanisms of urine formation. We have glomerular filtration, which happens here. Then it filters a lot of fluid from the blood, right? And not just fluid, a lot of components from the blood. If you like, keep laughing. Me and you, we are the same shock people's club. This is filtration, all right? A lot of filtration, a lot of fluid are filtered, right? Then from there, there's reabsorption. There's something called reabsorption. Reabsorption is the blood looking at and saying, this tube took a lot of things from me. I'm taking it back. Reabsorption is the blood, we're taking it back. So the blood is taking a lot of fluid back. It's taking a lot of electrolyte back. It's taking a lot of nutrients back. That is what reabsorption. So the blood is reabsorbing, taking back. That's reabsorption. Now, in the process of the blood taking back, the blood will now see, oh, I took back a lot of dirty things, right? With the good things. So the blood has to push away the dirty things back into the urine, like hydrogen. So the blood what? Secretes. So we have what? Filtration, we have reabsorption, then we have what? Secretion. Filtration, reabsorption, that's blood. I'm the blood now. See, I'm red, eh? I'm the blood. That's what I'm wearing. This is red. Am I colorblind? So this is reabsorption, and secretion is when the blood is pushing away. Then after that, we have what? Water conservation. Those are the 4. You can't forget, though. It has to be in your head, not in your book. Somebody's writing. I don't know what you're writing. Should I call name? Okay. I know somebody's writing. It's the spirit that talks to me has told me that somebody's writing. So these are the things you need to know, right? I don't want to waste time. So there are things, the membrane. Like, how do I explain this thing? I want to make you understand that, there are things that we allow things to pass through. You understand, in the kidney. So if they allow those things to pass through, we will know if that kidney is good or not. Now, there are anything that is greater than 8 nm cannot pass through this area. Like what? Like blood cells, like plasma, proteins, large anion. So if you see it in the urine of your patient, you know that something is wrong upstairs. Upstairs, I'm talking about is not here. I'm talking upstairs in the nephron. Something is wrong. Why? Because these 3 mechanisms are supposed to protect all those big things from passing through. Like what? Like what? Like the endothelium. This is the endothelium. You see? Endothelium. So they stop big things from entering. The second one is this guy here. This is basement membrane. So endothelium, basement. Epithelium is the same thing as epithelium. All right? The epithelium, see epithelium, cells that are linked together. Remember when we did epithelium, like simple cuboidal epithelium, you see? Linked together. These epithelium, they don't like things to pass through them. Feel me? So only tiny things can pass through them. Blood cells cannot pass through them. You get that kind of, you get the vibe, right? If things passes through them, the things will now come after an epithelium. You see what? A basement membrane. So it makes common sense. Basement membrane will also filter. And if that thing passes through basement membrane, where will it pass? The last one will become what? The processes, the food processes, the podocytes. Look at it. Does this not look like your foot? Yes. Doesn't it look like your foot? Look at this person's foot now. Is it not look like a foot? This is like a baby's foot. Another baby's foot, another baby's foot, another baby's foot. That's why we call it what? Foot processes you cannot forget. Chakam, if you forget. If it's my people. So what are the things that could pass through all these layers? Things like what? Water, electrolytes, glucose, amino acids, fatty acids, vitamins, urea, uric acid, creatinine. Then we ask you, what are the things that could pass through? What are the things that could be filtered? Do you understand? This thing can actually be filtered. Remember, glucose is good, right? So when it's filtered, the body, the blood will look at it and say, is that not glucose? Please come back to me. The body will reabsorb it. But if there is too much glucose in the blood, the body cannot reabsorb all of them. So a lot of glucose will be pouring out in the urine, and that's what we call diabetes. So because of this reabsorption, that's why too much glucose is not pouring out. So if in as much as it's filtered, it will go back into the blood for a normal person. Okay. So that's that. Please go read it up. Go read the things that could pass through the epithelium, basement membrane, and what? Filtration slits. That filtration slit is podocytes, all right? So just go look them. These are the things that could pass through. When you see protein in urine, it's protein. Urea, when you see blood, is hematuria. Then Think about the pressures. I mentioned these pressures, the three pressures that controls what is filtered, right? Like the BHP, that's the blood hydrostatic pressure, the colloid osmotic pressure, and capsular pressure. The net pressure, if you add, like, the hydrostatic pressure is the one that is trying to push the fluid into the tube. Look at it. Look at the yellow guy here. It's 60. 60 mmHg, millimeter mercury. You understand? It's trying to, this force is pushing the fluid away from this afferent and efferent, the blood vessel, into the tube. Why these two guys, the colloid oncotic pressure, osmotic pressure, and the capsular pressure, are pushing the fluid backwards. All right. But at the end of the day, the 60, if you add 32 and 18, you understand, it gives you 50. So the 60 is still 1 by 10. So that 10 extra, that's how it the net pressure, look at it, net filtration pressure that the blood is what using to go in, that the fluid is going out of the blood vessel into the tube. That net filtration pressure, you understand, is 10. So you need to know that this is the mathematics, and that's exactly why here, you see, there is a whole lot of fluid that passes here, almost about 180 liters. Look at it now, 180 liters for male and 150 liters for female. So there's a lot of fluid that's pouring out. So the question is, in the entire day, how many fluid do you push out? At the end of the day, how many do you push out? At most, you push out 1 liter. 1 to 2 liters at most. But what do you filter? You filter 150 to 180 liters. If you are a biological female, 150. If you are a biological male, around 180. But you urinate 1 to 2 liters. So where does the remaining 179 go? Wisdom. That's what you should ask yourself. And that remaining is, go back into the blood through what we call reabsorption. That was what I was talking before. So if you look at this place that is looking somehow, 99% of filtrate is what? Reabsorbed. Since only 1 to 2 liters are urinated in a day. And that's why, guys, you guys that are nurses, a lot of you that are nurses, one of your things you do in the clinic is what? To check the fluid output and input. You understand? You need to know that output and input is very, very important, because what you are checking is your patient's kidney, especially the patients that are admitted in the clinic. You understand? You are trying to check their kidney function. Oh, what amount of you? Okay, like if somebody's kidney is having a problem, how will you show? You usually show by having a problem in the physiology. Some people will be like, oh, maybe it's flank pain. Flank pain is usually stone. That's the truth. Usually stone. If it is a real kidney problem, it will show by a patient will come to your clinic and say, doctor, I'm drinking a lot of water, but I'm not urinating. Meaning that kidney is not forming urine. Do you understand? Or you check the person's urine. You now say, okay, let me take some little urine from you. You take the person's urine and you check it. What are you seeing? You are seeing red blood cell in it. Why? You are surprised. Because you knowing physiologically that red blood cell is not able to pass through those 3 membranes that we discussed. The epithelium, that's the endothelium, the basement membrane, and the podocytes. It can't pass through. So why are you seeing blood in it? You see, you get the wisdom. You get the wisdom. You don't say, oh, maybe this person has a glomerulonephritis, an inflammation in the kidney. And that inflammation will widen that place and blood cell can pass through. Oh, okay. You start asking your patients, oh, do you have edema? Oh, do you have any reaction? Oh, do you have this? Do you have this? Do you have this? Immediately you go into action. You check the SEUCR or the BUN. BUN is blood urea nitrogen. You ask your patient, are you vomiting? Are you doing this? Are you having diarrhea? What are you trying to figure out? Azotemia. Then immediately you check the BUN and you are seeing that the BUN is 25. Hey! Egbami, something is wrong. Action. Do you understand? It becomes an emergency immediately. You check the SEUCR. You know what SEUCR is? I told you guys. Serum electrolyte urea creatinine. You see that there is so much urine in the urea in the blood. Why? Because the blood is supposed to push out urea. It's supposed to the kidney is supposed to filter urea. The kidney is supposed to filter creatinine 100%. No, 99%. Now you are seeing an extended amount of creatinine in the blood, meaning that the kidney is not doing its job. The physiology of the kidney has been thwarted, and when there is a problem with the physiology, it becomes what? Pathology. But you must know the normal That is why you are doing this course. Okay? All right. If GFR, that's a glomerular filtrate rate, is too high, what are you thinking about? You are urinating a lot of blood, a lot of water rather. You understand? Before you know it, the person becomes dehydrated. There is electrolyte depletion as well. And if it is too low, what happens? A lot of waste is taken back into the blood, leading to what? Azotemia. Okay, so that leads to the control. Please, if I finish control, I will not continue, all right? These are just the parts that are so important. Now, think about the control, all right? Regulation of glomerular filtration. Major 3 controls. 1 is auto-regulation. The kidney controls itself. That's 1. 2 is sympathetic control. Another one is what? Hormonal what? Control. Now, talking about renal auto-control, how does the nephron adjust itself? If there is too much GFR or too little GFR, how does it adjust itself? There are 2 ways it does this. All right. One is using the muscle. We call it myogenic. And another one is tubuloglomerular feedback. All right. I hope you understand these 2 concepts. And it's very simple. If the blood pressure, the arterial blood pressure listen, I told you guys that blood pressure being high is that fluid is too much in the blood. Simple. I'm telling you, if you drop the fluid, the pressure comes down. Chicken, huh? Too much fluid in the blood. All right. So if arterial blood pressure increases, what do you do? Okay? You go to the afferent, that's A, and if the blood pressure is too increased, what the afferent, you tie it. If you tie it, blood will no longer enter the glomerulus. You understand? You constrict it, preventing blood from flowing into the glomerulus. Before you know it, the pressure decreases. That's myogenic control. And that's opposite of what when blood pressure falls. The blood pressure falls, the afferent artery naturally opens up, widens up. I need you guys to think about it. If this my room now, a lot of people are rushing into this room. 20 people are dragging to enter the room by force. What should I do? That is high pressure. If I want the pressure to come down, I just lock the door. Everybody should wait outside. Naturally, the pressure goes down. And if maybe there are few people that are entering, what do I do? Maybe because the door is too small, I'll just widen it more. So if arterial blood pressure falls, what do? I dilate the body, the kidney naturally dilates the afferent artery. Then the blood pressure will do what? Increase. Everything is talking about homeostasis, getting to the balance. All right? Extremely important that you know this. Now, the second one under renal autoregulation is known as what? Tubuloglomerular feedback. You understand? This one is where we use something we call juxtaglomerular apparatus. Just at the glomerula. I like that name. Juxtaglomerular. Just at. You understand? It's just usually found, just a structure that is found around the end of a nephron loop. All right? Where it re-enters the cortex, the renal cortex. Extremely important. So, but what do you need to know? There is something we call macula densa. You understand? Macula densa is also found around that nephron loop. And macula densa is what really helps before the juxtaglomerular cells come into play. All right? Now, when the GFR is high, that's the glomerular filtrate rate is high. If a lot of people are rushing into this room now, what do you think will happen? Because they are rushing, they will start sweating. They'll be sweating because they are rushing fast. And if they are sweating, what happens to them? They have become high, sweating contains a lot of salt. That's sodium chloride. That's how I want you guys to remember it. So when the GFR is high, filtrate contains more sodium chloride, more salt. Your sweat has salt, more salt. And because it has more salt, immediately this macula densa absorbs this sodium chloride. There's more salt too. Hey, I need energy to be able to check this salt, to break down this salt. Immediately, it secretes ATP. Because of that high salt, and there is high salt because there is high GFR. That means there's high blood pressure. So high blood pressure leads to what? High salt, sodium chloride. And it is that sodium chloride that attracts fluid into the blood, leading to that high blood pressure. That's why your patient comes to the hospital, has blood pressure. What do? You tell the patient to stop salt. Why? Because salt attracts a lot of water into the blood. And when a lot of water enters the blood, it leads to what? High blood pressure. Chicken, huh? So when GFR is high, that means there is high salt. Chakam. And when there is high salt, the macula densa immediately absorbs this salt. It secretes what? ATP. What is ATP? ATP is adenine triphosphate, 3 phosphates. And immediately it metabolizes ATP, and it produces this ATP, right? Now, there are some cells that are close to the macula densa. They are called messenger cells. These messenger cells, we now break down the ATP. You understand? And break it down and create something we call what? Adenosine. Just adenosine alone. The phosphate, they will remove the 3 phosphates. And so it will be adenosine and another 3 phosphates. So that triphosphate is out, but adenosine will remain. Make sense? And what breaks down, that's messenger cells. Now, the adenosine itself will now stimulate the granular cells. That granular cells is known as what? Juxtaglomerular cells. It will stimulate it. Remember, sodium chloride, macula densa produces ATP, messengers break down ATP to adenosine. Adenosine does what? Stimulates nearby granular cells. What is granular cells? Granular cells are just smooth muscles. And immediately they are produced, what will happen? Granular cells will go and tie themselves around that artery. Tight. And what is it tying? It's tying what? Constricting what? The afferent. So it's always that big door, the afferent. It will go and tie it and close the door. And blood pressure will fall. So at the end of the day, the tubular autoregulation, the two of them, both the myogenic and the tubuloglomerular feedback, is still talking about what? Tying or constricting of the what? Afferent. That is if the blood pressure is high. And if it is low, they relax it. Okay. So that's it. Now, this is wasting my time. Look at this picture, that letter, right? Use it to do your... This is exactly what we just discussed. Now, the second one is the neurogenic what? Control. When you talk about neurogenic control, the major thing we are focusing on is sympathetic control. I told you what sympathetic is. You understand? Remember, if I touch you, that sensory goes to your CNS, right? That's the brain and the spinal cord. That sensory, afferent nerves, neurons, goes to the brain and spinal cord. Relays the information, and information comes back. You understand? So when it's going either from the skeletal muscle or the smooth and the cardiac. So when let's put the smooth and the cardiac together. When the information is coming back, if it's going back to the smooth and the cardiac, all right, it becomes what? Motor, visceral motor. And that visceral motor is something you cannot control. That's why we call it what? Autonomic. Now, autonomic nervous system is divided into two. We have the parasympathetic and what? The sympathetic. This is the sympathetic. That sympathetic goes to 3 major places. Or let me say 2 major places. One is the urinary system. 2 is the cardiovascular system. So it goes to the cardiac muscle and it goes to the smooth muscle. It can be urinary system, digestive system, and cardiac system. All of them are smooth muscle. If sympathetic goes to the cardiac system, what does it do? It will activate it. Fight and flight. Your heart will be beating. But if the sympathetic goes to the smooth muscle, it will have an opposite effect in the smooth muscle. That's why when your heart is beating fast and you are running, maybe there is a snake in your room right now. Check your bed, though. Some people will start checking. I was just kidding. So what do? Your heart will start pumping. Beep, 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 beep. You and run. All right? As your heart is pumping, that's sympathetic. At the same time, your urinary system is locked up. That locking up, you understand, is also sympathetic. That's when you are running, you don't feel like shitting or pissing. You know, going to the toilet or urinating. Somebody will say, ew, that's your problem. So that's about sympathetic, guys. Let's talk about the hormonal. So I told you there are 3. Autoregulation, which we discussed, which is myogenic and what? Tubuloglomerular. The second one is what? It's neuronal, usually sympathetic. And the third one is what? Hormonal. And this is the third one here. All right? I just use this diagram to explain. And you guys can, figure it out yourself later. All right? When there's a drop, this hormonal usually deals with then there's a drop in blood pressure. Make sense? When there's a drop in blood pressure, the kidney will secrete what we call what? Renin. Look at it here. The kidney secretes renin. This is renin here from the kidney. What does the renin do? Renin will, now the liver produces a protein we call angiotensinogen. Remember, gene is an inactive. Anything gene, zymogen is inactive. Oh Lord, oh Lord. Anybody that introduced me to this thing, God bless that person. You know what I have here? Lemon, hot water, lemon and hot water, lemon and honey. Hi, wicked. Hi. This one is activating my renin-angiotensin-aldosterone system. Oh. Okay, so this is called what? RAS. Renin-angiotensin-aldosterone what system? RAS system. I need you to remember that RAS is... Leave the hot water. Killer, you are still remembering the hot water. Please leave that one. Leave that one. That one is an old story. This one is lemon, hot water, and honey. You know, when I was having is it cough? Yes. Flu. Yes, that's what you guys call it here. When I was having flu, somebody introduced me, Nchebe, just take honey and lemon. The day I tried it, my life never became the same again. You are laughing. Okay, guys, let's go. So when your blood pressure is low, that is when RAS jump into the equation. I immediately, chakam, emergency. Kidney produces renin. Renin breaks down angiotensinogen into what? Angiotensin 1. It is still inactive. Look at it. You see this angiotensin 1? It is still inactive. It can't do anything. And immediately, angiotensin 1 is converted by angiotensin converting enzyme to what? Angiotensin 2. Angiotensin 2 is active. And remember, angiotensin converting enzyme is from what? The lungs. Convert it to angiotensin 2. Angiotensin 2 does 3 things for you. 1, it sensitizes the hypothalamus. What is it telling the hypothalamus? Remember, guys, I told you that when blood pressure is low, it means that the quantity of blood in your fluid in your body, or not in your body, in your blood is low. Check it out. So immediately, the angiotensin 2 will tell the hypothalamus that, hello, Oga. Please, this person's blood volume is low. The fluid volume in the blood is low. Let's give him fluid. So immediately, the hypothalamus will make you thirsty. You drink water. That's why sometimes you become very thirsty. You don't know. It is your body that is making you thirsty. Why? Because your blood pressure is low at that moment and you don't know. So it's trying to help you go back to normal, homeostasis. So the hypothalamus immediately gives you water. Makes you drink water. You drink water, and immediately that water enters through the intestine, into your blood. Your blood volume increases. Blood pressure increases. Corrected. Number 2, it can cause something we call vasoconstriction. Look at it. Vasoconstriction. Do you understand? Vasoconstriction is pressing everywhere, blocking everywhere that blood is leaving. Why? Because we want blood volume to what? Increase. That's number 2. Number 3 is by helping water to come into the blood. And how does it do that? It will go to the adrenal cortex here. The adrenal organ here. This is adrenal organ. Adrenal organ has 2 parts. We have the cortex and we have the medulla. We have the cortex and we have the medulla. In the cortex, we have 3 regions. I always remember it as GFR. But GFR, forget about the fluid we were discussing about. GFR here is glomerulosa fasciculata and what? Reticularis. Then the other part is the medulla. Medulla that produces what? Catecholamines, like epinephrine. That's medulla. Adrenal medulla produces catecholamines. Epinephrine, not epinephrine. But we are concentrating on the cortex. The cortex has 3 parts, GFR. The glomerulosa produces what? Minerals. Like what? Like aldosterone. The fasciculata produces what? Glucocorticoids, like cortisol. So here we are concentrating on the first part, which is what? The glomerulosa, which produces what? Mineral corticoids. Example of mineral corticoids, it produces what? Aldosterone. Look at it. That's why you have aldosterone in this picture. So this angiotensin 2 synthesizes adrenal cortex to produce aldosterone, What does aldosterone do? Aldosterone is salt retainer. It will retain salts, and as it's retaining salt in the blood, the blood will become what? Hypertonic. And what happens in a hypertonic solution is start dragging water into it. So as it's dragging water into it, the water volume in the blood starts rising. You understand? And your blood pressure that is low starts increasing, and becomes stable. 3 things. So you must learn these 3 mechanisms. This is story. Read it at your leisure time, all right? And I said I'm going to stop here because virtually everything is now talking about the same thing. You understand? You know about transport maximus. You need to know about this antidiuretic hormone. Now, there are some hormones that are very important for you to know. You guys know the function of antidiuretic hormone. First of all, you know where it's produced. It's produced ADH and oxytocin are produced in the ADH is produced in supraoptic nuclei of the hypothalamus, all right, and the oxytocin is produced in the paraventricular nuclei. But the 2 of them are not produced in the posterior pituitary. Instead, the 2 of them are stored there. You must remember this thing. That's from endocrinology, all right? Because some questions there might just jump out and you may never know, all right? So the ADH helps what? To retain water. Extremely important, all right? Especially when you are dehydrated. This is how your body controls dehydration. Look at it. You are dehydrated, the urine becomes scanty, more concentrated. Immediately, the osmolarity tells the posterior pituitary to release what? ADH. Then ADH then increases the synthesis of aquaporin channels by renal tubular cells. And immediately it does that, a lot of water is what? Reabsorbed by the collecting ducts. At the end of the day, ADH is when you are dehydrated. All right? And if there's a problem with ADH, what will happen? Your water will not be coming back reabsorbed. A lot of water will be leaving through the urine. A whole lot of water will be leaving through the urine. You understand? That's what we call what? We call diabetes. Is it diabetes? Diabetes. What is wrong with me? Hold on, let me drink this thing. If I drink it, my brain comes back. Stop it. Okay, we call it diabetes insipidus. All right? You need to know the difference between insipidus and mellitus. Insipidus is usually caused by ADH, something wrong with ADH, always. All right? Then you need to know about the cantecholinate mechanism, the multiplier, all right? How it maintains salts. You need to know this, all right? Where the vasa recta comes into play, you must know this. You need to know the summary of the reabsorption and secretion, things that enters and things that leaves. Extremely important, all right? Then you talk about the composition of urine. You need to know the pH of the urine. You need to know the osmolarity of the urine. You must know the osmolarity of the urine. And you must know the density of the urine, 1.001 to 1.028. It will shock you when you see this question. Kinda. May the spirit lead you as it's leading me. All right? You need to know these things. Normal volume of urine 1 to 2, polyuria, oliguria, and urea. You need to know these 3 concepts. All right? Then this diabetes, this is pathology. This is diabetes type 1, type 2. You need to know what the difference between the 2 of them. And I've already talked about hyposecretion of ADH, which causes what? Diabetes insipidus. All right? You need to know about the diuretics. As I keep telling you, when you know the normal, you'll be able to know the abnormal. When you come to the clinic and want to check your renal function, these are the things you are looking out for. We want to evaluate severity. First of all, make diagnosis of kidney problem, the severity, monitor the progress, determine the clearance, and also determine glomerular filtration rates. All these things are discussed here, which you should learn. All right? Then you need to know the structures like urethra. You understand? You need to know the difference between urethra and urethra. You need to know the mucosa of the urethra, which is what? Transitional epithelium. You will not forget to. You also need to know the urinary bladder. Extremely important that you know the bladder, the 3 layers of the bladder, the peritoneum, the muscularis layer. You understand? That has smooth muscles like the trousseau. You understand? And it's transitional. Remember. Okay? This is diagram for female. You need to also know the about kidney stones, though this is not pathology, but just know it for knowing sake. You need to know the difference between urethra of male and female. You understand? And the clinical significance of the difference in the length. Should I tell you? No, go and read it up. This one is little, all right? So this is male. This is long. See how long it is. See how long. I'm not talking about the penis, so I'm talking about the urethra, because I know you are thinking something else now. Evil people. Okay. Then the UTI, cystitis, pyelitis, pyelonephritis. You need to know the differences between them. What is voiding? What is micturition? The reflexes involved. How do you urinate? And all those things. Renal insufficiency, hemodialysis. Okay. How many minutes did I take? Hey, Jesus. I told you guys, once it's 20 minutes, you should tell me. Were you carried away? You were enjoying my voice so much that you were carried away. Okay, let's jump into. Don't worry, we'll be very fast. All right. Urinary system is not a big deal. You guys already know it. So we'll be very, very fast. Are you ready? Let me see you if you're ready. Who is ready for me? What's happening? My voice sent you to sleep? Oh, Lord. Wake up, wake up, wake up. Okay. Wake up. How can you be sleeping? In this hour? This is the longest time to sleep. Oh. Okay, ready. Please, the rule is take this as an exam. You understand, Kalisha? Take this as an exam. She'll be like, why did he call my name? Take this as an exam. Jordan, you are very funny. What's that emoji for? Who broke your head? Hey, Jehovah. So, guys, take this as an exam. So I need you to just keep everything out. I just want you to answer. Don't be too carried away with writing the question or whatever. Just understand that was a full class. Yes, that was. I want you to answer straightforward. All right. Now it's as if I discussed this because I know I've discussed this with you, or your different professors must have discussed this with you. So now just attempt the question very fast. I need you to be very fast. This energy. Give me energy. You know me, I work with energy. All right. I'm very stressed out today. I'm extremely stressed out. Honestly. Like I just want to sleep right now. Yeah, understand? No. So don't make me sleep. Give me energy, all right? If there's any question you ask, and if you don't know it, please 911. 911. We're only doing urinary system, and then we take some pictures. Oh boy. And this urinary system, I think it's yeah, that was a I'm sorry. It's okay. Okay. Okay, guys. So let's start with this. You say, oh no. Let's test the microphone, guys. Sorry. Somebody will be like, all this preparation for the questions. Sorry. If you people are very fast, we can finish these questions in 30 minutes. Trust me. But I know very soon I'll be begging you to answer. Okay, let's go. Which of the following is not true about the anatomy of the urinary system? Okay, please. I'll post the options. Incoming. This is A. This is B. This is C. This is D. And this is E. Energy, guys. This is just testing the microphone, no? Let me see. I'll call names of people that are not responding. No? Let me see. Okay, Jordan has responded. Karin, Caitlin, Anadia, Donnell, Anadia, Caitlin, Jordan, Kalisha. Kalisha know that I'm going to call her next. Okay, Chaperon has responded. There is Mr. Song and Vedette. Okay, you guys are so correct. The answer is D, guys. You understand? Everything is true. The kidneys are retroperitoneal. The ureters connect the kidneys to the bladder. The urethra of the male is longer than the urethra of the females. The right kidney is located more inferior than the left kidney because of the suppression of the liver. All right, you know how the liver pushes it down. You understand? So the answer is D, guys. The kidneys are at equal heights within the pelvic cavity. They are not. They are not at equal heights. All right. The right kidney is more inferior to the left kidney. Okay, that's just a testing the microphone question. No. Hello, hello. Okay. Look at this question. Look at the question here. This is A. This is B. This is C. This is D. This is E. So which of the following is not a function of the kidney? They regulate osmolarity of the body fluids. They fight osteoporosis by synthesizing vitamin D. They help control blood pressure. They release the majority of waste into the blood. They indirectly increase the oxyhemoglobin. Come on, guys. Let's shoot. The faster, the better. If we go fast, we finish fast. Yes, you guys are so right. All right. They release a majority of the waste into the bloodstream. It's not true. It's not true. Why would they want to release into the bloodstream? No. So that's the problem. That's the wrong question. So the answer is D. You guys are so correct. Now I'm not going to give you guys an option on this. I'm not giving an option. There are some questions I won't be giving option because giving option is waste of my time. It's too cheap. It's too cheap. Yeah, D is correct in that question. Look at this question. What's the answer? A byproduct of protein catabolism. Dash constitutes approximately 1/2 of all nitrogenous waste. Simple. Like, what is byproduct of protein catabolism? When you break down protein, what do you get? As a byproduct, as a waste, what do you get? Is it urea? Is it creatinine? Is it uric acid? Is it azotemia? Is it ammonia? You see, this is a giveaway question. This is testing the microphone. It's a hello, hello question. I need more people to comment. The earlier the better. Perfect. You guys are so correct. The answer is urea. All right. Oh yeah, this one I'm not also giving you option. The answer of that question is urea. I'm not giving you option in this one. The medial concavity of the kidney is called the dash, which admits the renal nerves, the blood vessels, the lymphatic vessels, and also urethra. Answer. Yes, urea is correct in that question, guys. Yes, urea is correct. Come on, guys. Perfect. You guys are interesting. So, hilum. Okay, I told you this kind of question always comes out. They love it. They love it. They love that question. Okay, let me give you another question. Look at this one. They also love this question. What's the answer to this question? We talked about how they enter. Now, how do they go out? We've discussed the door that admits them inside. Now, we're talking about the door that takes them outside. What is the answer? Okay, let me give you an option. Corticomedullary junction, sinus, ureter, pyramid, and hilum. What was the answer? It seems these people are not falling to the prank. They are not falling for it. They caught me. These people are, they are really, you guys are radio. Eh? Eh? You guys are so radio. I love it. I love it. Too much brain is worrying you guys. Too much brain. It seems you guys watch my video very, very well before even this class. That's good. And you read. I love it. Oh yeah, tell me the answer to this one. This is testing the microphone now. All of you are just gingering. Testing the microphone. When we enter the main thing now, I hope you continue like this. A renal pyramid voice urine into dash. Yes, Karen, that's hilum. The two questions are hilum. How they enter, how they exit is always hilum. All right. But now we're talking about the renal pyramid. Where does it void urine? We have the minor calyx, we have the major calyx, we have renal medulla, we have the renal papilla, we have urethra. Perfect. Perfecto. You guys are so active. Yes, it's minor calyx. Look at this question. Blood plasma is filtered in the. Where is it filtered? I'll give you option, but I will read out the option. So pay attention, all right? Just once. A, renal tubule. B, renal corpuscle. C, renal capsule. D, renal column. And E, renal calyx. Blood plasma is filtered in the A, renal tubule. B, renal corpuscle. C, renal capsule. D, renal column. And E, renal calyx. Perfect. It's renal corpuscle. Don't fall for it. Don't let them deceive you, all right? Okay. Renal corpuscle. Yes, that B is correct. That B is correct. Look at this question. This is A. This is B. This is C. This is D. Oh, sorry. This is D. And this is E. The question? I get the question. A single lobe of a kidney is comprised of what? Can't you guys see the question? You can't see this question? This is the question here. I posted it first. A single lobe of the kidney is comprised of what? Oh, okay, sorry. I just posted it again. A single lobe of the kidney is comprised of dash. We have two calyces and a renal pelvis. We have one pyramid and the overlying cortex. We have one major calyx and all of its minor calyces. We have a renal medulla and two renal columns. We have one collecting duct and all nephrons that drain into it. See, ginger, energy. I'm feeling it. It's just testing the microphone. Don't worry, when we enter the main thing, I hope to get this energy. Oh. I hope to get this energy. Oh. Don't tell me you have slept. Oh. Okay, yes. The correct answer, one pyramid and an overlying cortex. Don't be deceived when they try to trick you with this question, all right? And remember, an average person has 1.2 million nephrons. Remember that. I'm not going to stress on it. Yes, sometimes I post question because I noticed it when I took the other class and it will not appear. So please, if you don't see the question, tell me, all right? So for now, I just posted this particular question. I'll give the options by mouth. If you can see the question, I say, which of the following form the inner layer of the glomerular capsule and wrap around the capillaries of the glomerulus? A, macular denser cells. B, mesangial cells. C, nephrocytes. D, podocytes. And E, monocytes. Macular denser cells. You don't see the question? Oh boy, something is wrong, though, because like I don't know if I'm the problem or it's from my village. I just posted it again now. I hope you see it now. Now we see it. Maybe Apple is not good, though. Me, I don't understand because when I was using my other laptop, it's the only problem is the delay. No, it's not delayed. I posted it a second time, meaning that first one you guys didn't see it. And the other class, they also complained the same thing. I have to go get to the root of this problem. So the options again: A, macular denser cells. B, messenger cells. C, nephrocytes. D, podocytes. And E, monocytes. Let's go, guys. This one is not tough now. We are still testing the microphone. I hope we don't end up testing only microphone this night. Yes, the answer is podocytes, guys. The answer is podocytes. I just posted this question. Which of the following is not composed of cuboidal epithelium? Can you see it? Can you see it? Yes, okay. So this is A. This is B. Perfect, perfect. Chaperone, you cannot see it. That means it's your laptop. Oh. Your laptop is not seeing very well. Because every other person can see it, only you. This is D and this is E. Please don't go to your slide. Just answer. You understand? If you're not sure. The thin segment, which of the following is not composed of cuboidal epithelium? That's the question, Chaperone. Which one is not composed of cuboidal epithelium? Yes, the answer is that the thin segments of the nephron, right? That one is simple squamous. Okay. Look at this question. I hope you can see it. I'll be hitting the enter very well because, like, I don't know why I can see question and you can't. It's terrible, man. I just posted the question. This is A. This is B. This is C. This is D. And this is E. Okay. Cortical nephrons can be distinguished from juxtamedullary nephrons by dash. Whether they drain into a collecting duct or directly into the renal pelvis, which molecules can pass through the filtration membrane, the size of the renal corpuscle, their location within the cortex, the filtration rate. Let's fire up. Are we losing steam? Please, if your gas is finishing, go to AP or go to Shell. Your gas cannot be finishing right now, please. It's too early. It's too early. If not, I'll start calling names. So yes, the answer is D. Yes, the location within the renal papillae. Oh, Karen, I know you're answering the other question. Yes, the answer to that question is A, the thin segments, all right? I know you're answering that other question. So look at this question, guys. I just posted the question. I believe you can see it. Anytime I post question, if you can't see it, I'll tell you what I posted. If you can't see it, please tell me you can't. This is A. This is B. Sorry. This is C. This is D. This is E. Okay. Which of the following correctly traces blood flow from the renal artery into the cortex? Quickly, guys. Are we still right? Let me see. Chaperon says segmental artery interlobar arcuate, segmental interlobar arcuate, artery cortical radiator. So that's C. This one is a giveaway. Oh, you know that, right? Let's go. Let's go. Let's go. Let's hit it up. Hit it up. Hit it up. Hit it up. Let's go, guys. Are we still looking at it? Everybody has to comment too. One, two, three. I'll call him so. You guys have to hurry up. Where is Karen? Karen, you've not. Where is your answer? Kalisha, are you sleeping? Okay, Jordan has answered. Gaby has answered. Anodia has not answered. Kathleen has answered. I'll start calling everybody now. You see, gas is finishing. Where is Vedette? Where is Kayla? Kalisha, you say 911? Really? Are you sure? This is asking question like, hello, I've not seen your answer. You didn't answer. You are just looking and smiling and drinking coffee. Please, I need you to answer very fast so that we can move. Everybody has to be answering. Please, don't just be looking for others to answer. Finally, Biden is here. Thank God. Blessed be the Lord. Listen, guys. They're asking tracing of blood, right? Blood flow from the renal artery into the cortex. You guys are nurses, so some of you will you'll be in dialysis. You need to understand these concepts, all right? And somebody said 911. Yes. We moving in from renal artery to segmental artery. Remember, immediately it enters the segmental artery, it's divided into two. You understand? Let me show you the diagram. Hold on. So this is the diagram. See, I'm taking time to do this because of the fact that somebody said 911. This is the diagram. This is the diagram. You understand? This is the diagram. When the blood moves from the aorta, all right, it goes to the renal artery, from renal artery to segmental artery. This is the renal artery here. If you can see my mouse pointer, this is the segmental artery, 1, 2, 3. Then from segmental to the interlobar, this is interlobar artery. From the interlobar, it curves to the arcuate, and it gives out this cortical radiator artery, radiating like this, all right? So that's exactly what they're asking you, because the question says, which of the following correctly traces blood from the renal artery? So they're asking you, from here, how does blood get from the renal artery into this cortex? This is the cortex. This is the cortex. All right. So that's why the answer to that question is C. Now look at this question. I want to ask you this question. Here's that question. Look at this question. I read the question wrong. Okay, let me see if you read this one right. Kalisha, I need you to be the first person to respond to this question. I just posted the question. I hope you guys can see it. I believe you can. Then this is A, part of it. This is A. This is B. This is C. So you have to pay attention to each of them so that you'll be able to pick the right one. Because you may know the writing in your head, but that writing may not be exactly how it's arranged. No question. Can't see it. Okay, don't worry. But you can see the options, right? I will repost the question. I don't know why posting of this question is becoming a problem. Okay, don't worry. So these are the options. Then this is the question again. This is the question again. I believe you can see the options. So this is the question again. Can you see the options, please? And I just posted the question again. We can see it. Okay. So the question says, which of the following correctly traces blood flow from the renal cortex to the renal vein? Let me remove this thing from the screen so that you guys will not be looking at it. Okay, so let's go. The options are there for you. So let me see who gets it correctly. Yes, you guys are very correct. So the answer is E. Let me see. Did Kalisha answer? Let me see. If you guys don't see the question, try changing the chat settings to all messages. So that means it wasn't about me, right? Kalisha, do you understand this question? Yes. Okay, you choose E. Okay. So now they're asking you from in to out. All right. From in cortical radiator to out. Remember that. Okay. Okay. Maybe I'm the one that didn't set something. I don't know. This YouTube, I don't understand a lot of things. Maybe it's the YouTube or maybe this laptop. I just posted a new question. I just posted a question there. And there are two options for it. This A. No, maybe it's from maybe I said something. I think there is something I said because I've never had this issue before until this week. Can't see the question again. And it only happens with the question, never the option. Don't worry, let me post the options and I'll post the question. Maybe I should start posting the question last. I think it's probably me. Maybe there's something I didn't set correctly. I'll look into it. All right. Don't worry. But before it wasn't happening like this. Look at the equation again. So the dash innervation of the kidneys reduces urine production, while the function of its dash innervation is unknown. What is the answer? I guess you guys can see the options. A is sympathetic, parasympathetic. B is parasympathetic, sympathetic. C is central, peripheral. D is peripheral, central. And E is enteric, somatic. Okay, yes, you guys are so correct. The answer is sympathetic, parasympathetic. Yes. You understand? The parasympathetic function is unknown, but the sympathetic function is known. All right? Look at this question. Or maybe it's the way I'm posting it. Okay, let me try something. Let me post it by pasting with my mouse and see. I've posted. Can you guys see this question? Yes? If you can see it, give me the answer. I'm not giving you option. Okay, no, I have to give you option. A is amino acid. Yes, you can see it. Maybe it's the way I'm posting it. Before I'm doing command and whatever. So the option is, listen to the option. A, amino acid. B, electrolytes. C, glucose. D, vitamins. E, protein. Amino acids, electrolytes, glucose, vitamins, protein. In a healthy kidney, very little dash is filtered by the glomerulus. Yes, you guys are so correct. The answer is protein. Yes, that's very correct. Okay, guys. What's the answer to this? Yes, the answer to that is protein. Let me see if you people will see this one. Let me do that Control V. I always do. And see. Can you see the question? Assuming all other values are normal, calculate the net filtration pressure in a patient with a drop in capsular hydrostatic pressure to 8 mmHg. Can you guys see this one? Yes, you can see it. So what's the answer? What's the answer, guys? These guys are radio. Okay, yes, the answer is 20. And somebody will be like, how do we get it? I know somebody now is thinking, how do we get it? But the person will keep quiet. And I will jump to the next question. You will keep quiet, and instead of you to say 911, let me tell you. Feel me? Just you know your formula. NFP is equals to what minus what? Do you understand? You get 60 is the hydrostatic pressure that we discussed initially. Remember, I told you. Then the other one is, you understand? Now we said the capsular pressure, we put it in the equation. That's 8. So 32 plus 8 minus 60. So it's 60 minus 40 mmHg. That gives you NPH of what? 20. NFP of what? 20 mmHg. And that is your answer. So they just tilted one of the parameters. All right. So you need to understand what they are telling you. So the formula, let me tell you the formula. NFP, that's net filtration pressure, is equals to glomerular hydrostatic pressure minus brackets colloid COP, that's colloid osmotic pressure, plus what? Capsular pressure, CP. So COP plus capsular pressure, when you get the answer, minus them from the glomerular hydrostatic pressure. They can give you any of the parameters. They can tell you, oh, assume that glomerular hydrostatic pressure is 50. You get it? That means every other thing is normal. So you need to know what is normal in every other thing. And the normal is what? Colloid pressure is what? 32. Colloid osmotic pressure is 32. Glomerular hydrostatic pressure is 60. Capsular hydrostatic pressure is what? 18. That's the normal. But in this question, they told you that 18, change it to 8. Simple. That 18, change it to 8. Who is doing 55? Oh, somebody said 911. Oh, okay. If you say 911, that means you don't understand what we are saying. So let me see if I can give you a better, clearer understanding. How do I do this thing now? I don't know how to write though. Inserts. Honestly, I don't know how to write. So what you need to do is just pay attention. If you, Kayla, you said 911. So what I need you to do right now is take your pen and paper and write exactly what I'm saying. Anybody that is listening to me and you don't understand, and Karin, that question is, you solved this wrong. If you don't understand, the question says assuming all other values are normal. So you need to write the normal. First of all, write the equation. The equation is NFP. Are you writing, Kayla? Are you writing? NFP is net filtration pressure, right? Equals to glomerular hydrostatic pressure GHP, that's glomerular hydrostatic pressure, minus, put a bracket, open a big coastal bra. In that first, if you open that bra, right, colloid osmotic pressure, COP, plus capsular pressure, CP, and close it. Now, under that equation, it writes their normal. Their normal under glomerular hydrostatic pressure, the normal is 60. Colloid osmotic pressure is 32. Just write it under them, 32. And capsular pressure is 18. So everything being equal, this is the normal parameters. If they tell you to calculate normal parameters, you just do 32 plus 18. That is 32 plus 18 is 50, minus it from 60, which is glomerular hydrostatic pressure. You get what? 10, which is what I showed you initially. If you look at this place, let me see. If you look at this place, this is what I showed you here. Exactly. So this is what I showed you here. Where is that calculation we did? Can't even remember where the calculation is. It's supposed to be around here. Oh, just give me a minute. Aha. This is it. So this is exactly what you just wrote now, Kayla. Now, in the question, they are telling you that assuming all the values are normal, calculate the net physiological pressure. So they are telling you to calculate this NFP, all right, in a patient with a drop in capsular pressure. So this CP, that is what they are telling you. That CP you just wrote. They said the CP is now 8. So what you need to do is to write 60 minus, you open the big bra, write your colloid osmotic pressure, which is normal. That is 32. Put 32 there. Then put plus. That capsular pressure they gave you is 8. So instead of putting 18, put 8. And give me the answer quickly. Body mass, you must do the bracket first. So what is the bracket? Colloid osmotic pressure. Okay, I get it now. So do the bracket first. What do you get in the bracket? 32 plus what they gave you, 8. Instead of 18, that is normal. Now they gave you 8. So 32 plus 8 will give you what? 40. Then minus it from the normal BHP. You understand? That BHP, glomerular hydrostatic pressure or blood hydrostatic, that's 40. Then minus it from that 60. And what you get is what? Come on. Let's go. No, it's not minus 60. Body mass, 32 plus 8 is what? 40. So 60 minus that 40. Remember, it is 60 minus, you open the bracket. This plus this. So this plus this, solve the bracket first. This plus this, 32 plus 8 is what? 40. Right? So what you get now is 60 minus 40. So 60 minus 40 will give you 20. That's how we got 20. But I need you to know the mass because they can give you anything in the clinic. Exactly. Because they can give you this thing in the clinic. They tell you, oh, this person's a BHP. Maybe they tell you, yeah, this person's BHP or GHP is 50 mmHg. And every other thing is normal. So what do? That means you do 50 minus open bracket 32 plus 18, which is 50. Close. So 50 minus 50 becomes 0. You tell them it's 0. And they will be hailing you. They say, oh, this girl is smart. This boy is smart. They say, who taught you? Who taught you? You tell them that it's Nchebe. But when they give you that question and you can say negative 60, if they say, who taught you? Don't call my name or I'll deny you. Okay, guys. Okay. So let's move. Let's go. Where am I? Okay. We took a little bit of time in that question. So very fast. I need you guys to give me very fast options because I will soon jump into this thing now. into the diagrams. So very fast. I have some questions. Very fast, very fast. Give me an answer quickly. I'm not giving option. Renal hydrolysis angiotensinogen, which is released from the dash to form angiotensin 1. They're asking you about angiotensinogen. Can you see the question, guys? Yes, okay, you can see them. Somebody is still laughing. Yeah, so please, if you get that calculation wrong, I did not teach you. It is not me. You understand? My name is Nchebe. It can be Bechen. Let's call the name backwards. Please, don't involve me. So the answer is liver. Yeah, you guys are so correct. All right. The answer is liver. So look at this question. You know, a lot of questions is most likely. I hope you can see the question I just posted. The question following would reduce the glomerular filtration rate. If you can see that question, I'll give you options. I know you know a lot of things that can reduce glomerular filtration rates, but you need to know which from your options. All right. This is A. This is B. This is C. This is D. And this is E. So which of the following would reduce the glomerular filtration rates, GFR? Is it vasoconstriction of the efferent artery? Is it a drop in oncotic pressure? Is it vasodilation of the afferent artery? Is it vasoconstriction of the afferent? Is it an increase in osmotic pressure in the glomerular capsule? You guys are really doing well, though. But if I ask the next question, if you don't answer, I'll call you out. You have to be answering. Yes, you guys are so correct. The answer is vasoconstriction of the afferent. I told you, if you don't know the answer, look for afferent. That A. But what you need to know is it vasoconstriction or vasodilation? Because I know somebody that put vasodilation and changed it and put vasoconstriction. That's good. So look at this question. Yeah, it's vasoconstriction, not just constriction. And which one? Because it can be afferent, it can be efferent. I hope you can see that question. I believe you can. So I'll post you this. This is A. This is B. This is C. Please answer this question as if you're in the exam hall. Some people say that they are tired. If you're tired in the exam hall, you say answer. You understand? If you see 200 questions in the exam hall, you say answer all of them. So please, you need to be up and doing, all right? Because I noticed that it's just a group of people that are answering and it's not nice. So the mechanism of stabilizing the GFR based on the tendency of smooth muscles to contract when stretched is known as DASH. Renal autoregulation, the myogenic mechanism, tubal glomerular feedback, sympathetic control, the RAAA mechanism, the renin angiotensin aldosterone mechanism. Fuel has finished. So Biden is the first person that answered. That means that's trouble. Oh. Usually she's the last person. No, she's the first person. I'm scared. Yes, you guys are so correct. It's myogenic mechanism. That's B. Very, very correct. What's the answer to this question? I just posted it now. I hope you can see it. In response to a drop in the overall blood pressure, that stimulates constriction of the glomerular inlet and even greater constriction of the outlet. We have yes, that answer is B. A is azotemia, B is sodium chloride, C is parathyroid hormone, D is aldosterone, E angiotensin 2. What's the answer, guys? In response to the drop in overall blood pressure, DASH stimulates constriction of the glomerular inlet and even greater constriction of the outlet. We have azotemia, we have sodium chloride, we have parathyroid hormone, we have aldosterone, we have angiotensin 2. Yes, the answer is angiotensin 2. You guys are very correct. Okay, so let's do some quick and ask me how many minutes do I have? Okay. So look at this question. The DASH is not a portion of the urethra. It's not a portion of the urethra, right? Let's see how quick you are. This is the easiest, this thing. We have A. Where is it? No, it's my mouse pointer. Where I'm looking for this laptop, stressing me. Stressing me too much. C. D. And E. The DASH is not a portion of the urethra. We have the external urethra orifice, we have the internal urethra sphincter, we have the prosthetic urethra, we have the membranous urethra. Which one is the answer? Quickly, 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 guys. Okay, you guys are very correct. The answer is B. You understand? So the question is, why is this internal urethral sphincter not part of the thing? It's extremely important that you know that. First of all, what are the actual portions of the urethra? All right, we have the prosthetic, we have the membranous urethra, we have the spongy part, that's the penile part. Then we have the external urethral orifice. It's actually an opening of the very tip of the urethra where the urine exits the body. That tip, you understand? That is the external urethral orifice. So what is the internal? So the internal urethral sphincter is actually located in the junction, of the bladder and the urethra. Where you see the bladder, this is the bladder, and where you see the urethra starts. That junction is known as the internal urethral sphincter. It helps to control the amount of fluid or the flow of urine into the urethra. Do you understand? But it is not considered part of the urethra. Instead, it is considered part of the urinary bladder wall. You understand? It's part of the urinary bladder wall. You need to know this. You really need to understand this. Okay, so that's why that answer is B. Where is everybody? We dropped. What is happening? Have they slept? Yeah, I should not sleep. Oh. So look at this question. No. Hold on. There's this question I'm looking for. Yes, this question. We are here. You are not here. So only 7 people that answered that question, and now I need 10 people to answer this question. So I'm going to post this question now. Can you see the question? Yes. Which two substances? I'm not giving you option. I need you to write the two substances, 1, 2, in the same line. Which two substances are most useful for determining the patient's glomerular filtration rate? I'm waiting for you guys. So we are slowing down. No time. I need to, in the next 10 minutes, I stop this stuff. I need to give you pictures so that I can free you. I have a meeting around 11:30. I'll be 10:30. Yes, the answer is inulin and creatinine. But in the clinic, we usually use creatinine because creatinine is produced in the body. Despite the fact that it's not cleared 100%, it's cleared around 90 something percent. But inulin is cleared 100%. But we don't use it in the body because we don't use it in clinic because we have to inject it. It's invasive. You understand? So we avoid any invasion since we have an alternative that the body produces. All right. So if we see a certain number of these in the blood, then make sure you get sleep today, Professor. I will. I will. I just have a meeting, brief meeting. You understand? Yeah. So no, it's not insulin, no. Inulin. And trust me, the first option there is insulin and creatinine. Please, oh, please. Thank God you said this, so that I'll be able to highlight it. Okay, hold on. Look at this question. Yeah, so look at this question. Oh. And this is the type of question they ask you in your NCLEX. I just posted the question. Can you see it? A hospital patient produces 4 ml per minute of urine with a urea concentration of 8 mg per ml. Venous blood draw reveals urea concentration of 0.4 mg per ml. What is percentage of the cleared urea from the glomerular filtrate? Please, if I didn't read it well, you read it. Okay, so give me the mathematics, guys, quickly. The answer is in percentage, so I need you to solve it and give me an answer quickly. Get B. What is your answer? I'll call out people that have not seen their answer. You need to solve this. Get B, what is your answer? By day. Jordan. Vedette. Don't run away from me right now. Caitlin. Steph. Okay, Steph has answered. She said 64. Okay. Who have I not called? Kalisha. Solve it. I need you to really solve it. Yes, the answer is 64. For people that do not know how we got 64, renal clearance, C. If you want to calculate it, just do, if you have your pen, okay, yeah, Jordan said 911. Okay, so if you have your pen and paper, I really have to learn how to write here. Honestly, like, I think this is what I will learn later. So, if you have your pen and paper, you understand, I want you to write C is equals to UV over P. Like this. C is equals to UV. Don't mind my handwriting. If you laugh, hey, somebody's laughing. If you laugh this night, so this is what you write. C is equals to UV over P. All right. So what is C? C is concentration of urine. First of all, C is clearance. All right, that's clearance. Then U is concentration of urea in the urine. That's why we call it U. The amount of urea that is in that urine. And from our question, the amount of urea in the urine is what? 8. So I write equals to 8 multiplied by V is the urine flow rate. What is the amount of flow? So you want to know the amount of urea, then the amount, how fast it is flowing. That's the rate. And from our question, the flow rate is what? Is let me see, is 4 ml per minute. So I'll write 4 over, what is P? P is concentration of the urea in the plasma. That's blood. That's why we call it P. So over 0.4. So this is what you should have. You can see, this is what you should have. All right. When you do this calculation, let me see. 8 times 4 is 32. 32 divided by 0.4. You will have this is you have 80. Yes, 80. Yeah, right? 80, yes. 80 ml per minute. This is what you have. This is your clearance. Your clearance is 80 ml per minute. I don't know if it makes sense. So now you want to calculate what? Clearance what? Clearance what? Rates or percentage cleared rather. Am I crazy? Percentage cleared. So how do you calculate percentage cleared? Percentage cleared is equals to clearance over GFR FR. This is percentage. Clearance over GFR multiplied by 100. Multiplied by 100 because they say percentage. So clearance over GFR multiplied by 100. So what do you have? Our clearance is what? Our clearance is 80. We got 80 over. What is the GFR? They said the GFR is what? Position of cleared. Okay, the normal GFR 125 per minute. 125. That's the normal GFR. So if you multiply it, 80 divided by 125 times 100, you get 64%. So you need to know the normal GFR. Look at exactly how your this thing will be. This is how your calculation will be. Don't mind my terrible handwriting. So you get your C, UV over P. You understand? You put your parameters. You understand? You get 80. Then you write clearance over the GFR. Normal GFR is 125. They usually give it. Then you just do times 100. So 80 divided by 125 times 100. You get 64%. All right? So that's it. Thank you. I'm so crude. I need to learn how to use electronics. Okay. This question, I don't know if this question is for your level, but this is a pure clinical question, and it's always coming out from your NCLEX. It's always coming out. Okay, so let's see. Because this question, I think the spirit is saying that it might be out in your exam. So let's make sure everybody's equipped. So look at this question, guys. Control X, enter. Control V, enter. Guys, look at this question. Your options is pyuria, hematuria, albuminuria, uremia, phenylketonuria. I want you to read the question. A patient enters a hospital after a motorcycle accident. He complains of mid-back pain. X-rays revealed both ribs and pelvic fractures. His emergency room examination includes urinalysis. When you are doing that urinalysis, what are you looking for? That's what they're asking you. Which of the following findings from the urinalysis would most likely suggest trauma to the kidneys from the accident, but not to the urinary bladder? You see the question? Wisdom. Look at the doctors in the house. Somebody say kidney function. There's no kidney function in the option. No. I caught the option for you. I hope you are not sleeping. Wake up, wake up, wake up, wake up, wake up. Eh? Slayer. Okay, you finally answered. I said pyuria, hematuria, albuminuria, uremia, phenylketonuria. Funny enough, is this particular group of people that are answering very fast. I don't know why others. Are you guys waiting for them to answer first? Hmm? So yes, the answer is albuminuria. Very, very important that you guys understand this. And why? First of all, you need to distinguish the damage. Listen, I'm saying this thing because you need it in the clinic. You need to be able to distinguish the damage to the kidneys versus the urinary bladder. Extremely important. And what are we looking for? We are looking for that glomerular filtration barrier that I mentioned initially. If there is a damage to it, how do you know a damage to it? It's usually albuminuria, not others. I'll tell you why. You understand? That filtration barrier allows albumin, doesn't allow albumin to pass normally. So if there's a trauma that causes physical trauma to the kidneys, you understand, that's what we call renal contusion. It can tear or damage that delicate filtration membrane. So immediately it damages that delicate filtration membrane. This allows albumin to leak into the nephrons and show up in the urine or in the urinalysis. That's why we have albuminuria. But if it is a bladder problem, listen, if it's a bladder problem, injury to the bladder will not cause albuminuria because the bladder does not have anything to do with albumin. I don't know if you understand. It doesn't have anything to do. So the only thing you may see there is blood in the urine. Wisdom. Want to kill these people. All right? The people that said this question. So what do you need in the urinalysis? If you see hematuria in the urinalysis, it's not specific. Trust me. It's not specific. Despite the fact that hematuria is very common in kidney trauma. You understand? But it's a very non-specific finding, right? Because a fractured pelvis could easily puncture or bruise the urinary bladder, which will still bring out blood. So if you see hematuria, you are not sure, is it the kidney or is it the bladder? What of pyuria? That one is just infection. It has nothing to do with acute physical trauma from an accident. All right? What of uremia? Uremia is blood. Emia is blood. It has nothing to do with urinalysis. You see how you get this answer? What of phenylketonuria? PKU. That one is just a genetic metabolic disorder. And we test it only in newborns. It has nothing to do with accident and physical trauma. So that still leaves your answer to what? Albuminuria. But if you want to test it in the clinic, because your attendant will be asking you, listen, why? Differentiate kidney function and bladder function. This is how you differentiate it. I hope you guys understand clearly why it is the answer. All right? So I will so let me wake everybody that is sleeping up before we jump into the diagram. Let me wake all of you up. So tell me the answer to this. To meet the definition of polyuria, the minimum daily output of the urine is what? To meet the definition of polyuria, the minimum daily output of urine is what? 0.5 L, 1.0 L, 1.5 L, 2.0 L, 3.0 L. L is liters. Wake up now, wake up. Where are you? I can see you are sleeping. Why are you sleeping? You are sleeping on duty. Yes, the answer is 2 liters. This is just a wake up question. No, all right. Even this one I want to send now. Look at the question. The pigment responsible for the color of urine is called what? It's called what, guys? The pigment responsible for the color of urine is called what? Yes, 2.0 is correct by the D. Yes. I just posted a question. The pigment responsible for the color of urine is called what, guys? Okay, I have very fast 3 questions to go. Very fast 3 questions to go. Please, I need you guys to answer me very fast, all right? Yes, the answer to that question is urochrome. You are very correct. Look at this question. Yes, urochrome. Apple Girl just joined us, so that's good. You're welcome. Because I've not seen you answer here since. So I know when people just joined. Look at this question. I just posted it. The overall purpose, urochrome is correct. The overall purpose of the countercurrent exchange mechanism or exchange system is what? I'm going to give you options, all right? So I need you to pay more than usual attention to these options so that you don't get it wrong, all right? But feel free to get it wrong. That's the idea of the revision. This is A. This is B. This is C. Where is Mr. Song? I've not been seeing you respond. What happened? Are you sleeping? Mr. Song, are you sleeping? Okay. So that's the question. The overall purpose of the countercurrent exchange system is to dash A, supply salt and urea to the renal medulla, supply nutrients and oxygen to the renal cortex, supply nutrients and oxygen to the renal medulla, remove the metabolic waste from the renal cortex, remove metabolic waste from the renal medulla. Quickly, guys. Quickly, guys. Finally, Mr. Sunday is back. Oh, it's Sunday, not song. See me spoiling your name since you kept quiet. Or maybe you didn't know it was here I was talking about. Yes, the answer to that question is A. Countercurrent exchange mechanism is supplying salt and urea to the renal medulla. Renal medulla, 20 times, renal medulla. I just gave you a new question. The countercurrent multiplier recaptures dash and is based on fluid flowing in the dash direction in the adjacent tubules. Option A, potassium, same. B, calcium, opposite. C, calcium, same. D, sodium, opposite. E, sodium, same. Should I give the options again? A, potassium, same. B, calcium, opposite. C, calcium, same. D, sodium, opposite. E, sodium, same. Come on, guys. Okay, so yes, sodium opposite. I want to give you guys the difference between countercurrent multiplier and countercurrent exchange. Pay attention so that you get this in once and for all. I will be very brief. I want you to divide in terms of structure, primary goal, and key movements. All right. For countercurrent multiplier, the structure is the nephron loop. That's loop of Henle. That went like this. That's countercurrent multiplier, nephron loop. But the countercurrent exchange, the structure is the vasa recta. That's the capillaries. Remember the vasa recta that usually is found in the juxtamedullary nephron? That is for the countercurrent exchange. But countercurrent multiplier is the structure is what? That nephron loop. That's one difference. Second difference is the primary goal. For the countercurrent multiplier now, the primary goal is to create the salinity gradient. But the countercurrent exchange, the primary goal is to maintain the salinity what? Gradient. So in the nephron loop, that's where they create the gradient. But the vasa recta helps to what? Maintain it. That's the countercurrent exchange, maintain, exchange, maintain. Why multiplier creates? Multiplier creates. And multiplier has to do with what? Loop. Exchange has to do with vasa recta. Multiplier creates, exchange maintains. I need you to know this. Now, what are the key movements? That's the third thing you need to know for each of them. For the countercurrent multiplier, it pumps out sodium and chlorine. And that's the question. Pumps out sodium and chlorine. But the countercurrent exchange provides blood flow without washing out what? Salt. So it maintains. It doesn't wash out salt. So it maintains. But for the multiplier, it pumps out sodium. But this guy washes out blood without touching salt. If you can remember these things I just explained, it will help you answer all questions, all right? I have one more question for you. Let me ask you this question and see how you respond to it with what I just said. Because the truth of the matter is that they give you this kind of question. They give you this kind of questions. Look at this question. Which of the following are primarily responsible for maintaining the salinity gradient of the renal medulla? Options. A. Pay attention though. A is cortical nephrons. B. Juxtamedullary nephrons. C. Collecting ducts. D. Proximal convoluted tubules. And E. Distal convoluted tubules. Cortical nephrons, juxtamedullary nephrons, collecting ducts, PCT, DCT. Are you thinking? They say maintain, 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 maintain. And from what I told you some minutes ago, I told you maintenance of salinity gradient is countercurrent exchange. And what do you have in countercurrent exchange? Vasaracta. And where is Vasaracta found? The only place it's found is where? You want to hear options? Cortical nephrons, juxtamedullary nephrons, collecting ducts, proximal convoluted tubules, distal convoluted tubules. What's the answer? Juxtamedullary. I told you Vasaracta is only found in the juxtamedullary. Does it make sense? This thing is a very simple, add 1 and 2 together. I told you that just Vasaracta is found in the juxtamedullary. Another way they can ask you this question is by putting countercurrent exchange in the question and putting in the option and putting countercurrent mechanism, multiplier in the question. And you'll be thinking, what is multiplier? What is exchange? Multiplier has to do with loop of Henle. But exchange has to do with what Vasaracta. Meaning, if it has to do with Vasaracta, automatically it has to do with juxtamedullary. And it has to do with what? Maintenance. It doesn't touch salt. Okay, guys, I think that's the much I can give you guys. You guys are the best. We already spent more than 2 hours. I didn't know it would get to this, but that's fine. At least we are fresh. So now, I'm gonna, let's see. How do I do this? Give me a minute. New. Okay. So I believe you guys can see. How do I get this page wider than this? Okay, let me see if I can. Okay, perfect. Perfecto. Nchebe, technology genius. I want to heal myself. God, no. Okay. So let's start from urinary system. You see this? You see this? Can somebody, I need like 5 people, to give me A to E. Just like write it on one line. Leave the amount of question. That's not important. Let's focus on what we are doing. A to E. It's not important. If they give you 100 questions in the exam hall, you choose how many you want to answer. If you want to answer 50, answer and leave the rest 50. It's not compulsory. You understand? You guys are so focused on questions. Focus on what we have here. All right? So I need somebody. Let me see. Karen, write. No, don't write it 1-1. Don't write A is renal cortex and jump. No, it will give us too much. Write it. If it's renal cortex, write renal cortex this. Just continue. The way you arrange it, I will know it's A to E. All right? So let's go, guys. You forgot E. Hurry, guys. There's some important thing I need to share with you. Exactly. You guys are so correct. Now I want to ask this question. This question. Hmm? Somebody should give me an answer of this question. Look at the question. Through which of these sorry. Through which of these structures does urine travel? Hurry up, guys. Let's finish up. We have other things to do. Through which of these structures does urine travel? You guys are so correct. It's CDE. You see this diagram? I believe everybody should know it too. True minor, major, calyx, and renal pavement. That's CDE. Yes, you're correct. Huh? My Eva has returned. She disappeared since. Now she has returned. Welcome back. What happened? Your network spoiled? So look at this diagram. You should be able to know which one is which. Okay, so can somebody? I am at work. Oh. I know you're at work. Can somebody just tell me what let me see. Which one is segmental here? Which one is segmental? Which one is segmental, guys? Segmental artery. A to E. Which one is segmental artery? Yes, Vedette, you are correct in the other question. CDE, yes. Yes, the answer to that question, you have to be faster, guys. There are some questions you need, and like some people, they make up their exams with these questions. So you need to be faster so that I can breach everything. Sometimes it's not just identification. You understand? Look at this diagram, guys. This A, B, C, D, E, F. Now, there are very special questions they usually ask you here. Very, very special question. So pay attention. Number one question they ask you is, antidiuretic hormone targets which region of the renal tube? Which region, A to F? Which one does ADH target? Yes, that answer is correct, Scalar. Yes, I think D. Yes, D is correct. All right, for that question. So we are in a new question. boy, I'm late though. Yes, the answer is F. I hope you are doing well. I miss your class. Oh, Sarah, how are you doing? Yes, I'm fine. Thank you so much. I miss you guys also. Thank you. So, guys, ADH targets the collecting ducts. That's F. All right. And remember, that F is not part of what? The nephron. Remember that. Look at this question, guys. Which of this region is permeable? Which of this region is permeable to water? Which region is permeable to water? If you don't answer, I'll move. Which region is permeable to water? From the diagram, you can see. What is happening? Where are my people? Hmm? Where are my people? Which region is permeable to water? Yes, C. C is permeable to water. Yes, you are correct. Now, look at this question. There are some other questions, but I'll just give you this. When you talk about loop of Henle, you need to be specific. And that option is asking you to look at A, B, C, D, E, and F. Choose one. That's how the option is. So, yeah, the part permeable to water is C. That thin descending loop, that part that is, they can ask you which one has simple squamous epithelium, and it is C. So look at this question I just posted. Most water is reabsorbed by the from the filtrates by which region of the nephron? A, B, C, D, E, F. Which one? They just want to confuse you. They are just evil. Yes, the answer to that question is B. Look at this question. Yes, the answer to that question is B, all right? Now, I have to get used to this thing now. You see this question? They need you to understand the organs. You need to be able to identify. Let me see. Okay, look at this question. Look at, you see this diagram? Yes, that question is B. Yeah, you're correct. You see this diagram? Look at the type of question they can ask you here. I just posted a question. In which of these structures is uretelium found? You know uretelium? Transitional epithelium. Which of the structures, as you are looking at it? Only one person. Where is Gabby? Foster, where are you? Okay, Gabby. Immediately I say, where is Gabby? Gabby, come. Foster, where are you? Jordan. Vedette. Karin. Easy Slayer. Killer. Bide. If you guys did not answer me, I will jump. And Gabby and Maeve, you guys are giving. Okay, it's okay. It's okay because the option is A, B, C, D, and A for A, B for B, C for C, D for D, and then E is B and C. If you look at that question, they say in which of these D's they are trying to. If you just hear D's, then it's two. That's the truth. You look for options that are usually two, even if you don't know the answer. Sometimes when you listen to questions, you understand. You catch the answers from it. You understand? The answer to that question is B and C. You understand? So sometimes you see the question in which of these structure. And what is B? Urethra. What is C? Bladder. So the two of them are transitional epithelium. Okay, but not every time. Oh. Not every time. Not every time. Don't mind me. Not every time. You see that thing I said before? Forget about it. It's not every time. Okay, look at this question. In which of these structures does urine move via peristalsis? Don't go and follow the formula. That's a very wrong formula. Come on, guys. Come on. Activate. Oh, Jesus. Yes, B. The urethra. Yes, that's where it moves through peristalsis. Look at this one. In which of these structures is the detrusor muscle found? Where can you see the detrusor? Kinda makes sense. Is it the formula? The formula doesn't make sense. Please don't follow that formula. Please. Yes, the detrusor muscle is found in the bladder. Okay. So that's that for urinary. Let me see if there are some pictures you need to be aware of in respiratory. We did respiratory yesterday, right? Yes. Yes. Yes, the answer to that question is C. You're correct. Let's see. Okay, you need to know the different types of the cartilages. Hold on, let me give you this diagram. Oh Lord, when will I learn to use this thing very well? See this diagram? Jesus Christ. Oh boy. Funny enough, I was supposed to have a meeting by 10:30 with the programmers so if any of you have not registered with the link, please try to do so. So what is A? What is 1? What is 2? What is 3? What is 4? These are types of cartilages. Extremely important that you know that. All right. What are the different types of cartilages? What is 1? Who can tell me what 1 is? In short, if you know 1, 2, 3, 4, tell me. I can give you option. You have cricoid cartilage, thyroid cartilage, epiglottic cartilage, tracheal cartilage, and retinoid cartilage. Those are the so among them, Give me 1, 2, 3, 4. Or just give me 1 to 3. 1 to 3 is okay. Just 1 to 3 is okay. Come on now. Come on, come on, come on. Just 1 to 3, guys. If you don't say, I'll go move. One, AP2 thyroid, 3, cricoid. Okay. Yes, you guys are correct. It's epiglottic cartilage, thyroid cartilage, and cricoid cartilage. It's very important that you know this. For real. Don't look down on this question. So that it doesn't look down on you. Okay. So that it doesn't look down on you. Let me see. I hope you can see the diagram, right? Yes. Let me expand it. Expand it for people that have eye problem. Okay. I believe you can see this diagram. You should be able to read this diagram for the clinic. Very important. All right. As identify respiratory volumes. What is 1? Okay, in short, let's do it this way. I want you to tell me 1, 2, 3. 1, 2, 3. In order. 1, 2, 3. Quickly, quickly. Don't waste time, please. I need to jump. Name the respiratory capacity labeled 1, 2, 3. Yes. So IRV, respiratory reserve volume, vital capacity, and I see. Yes. That is very correct. That is extremely correct. So that's for respiration. Let me see if there is something for it. Yeah. Okay, yeah. So let's see this for the lymphoid system. See this handsome biological male. Please let's focus on the labels. They can ask you which of these let's see this question quickly. Look at this question, guys. Which of these organs shrink significantly by adulthood? And there's a follow-up question there. Which of these is the largest? Somebody said thymus. Which one is thymus in the option? That's what they're asking you. There's a follow-up question there. Which of these is the largest lymphoid organ in the body? You have to pick A, B, C, D, or E. You are still saying thymus. There's no thymus in that option. You are saying spleen. There's no spleen in that option. Choose A, B, C, D, or E. Look at where the arrow is pointing and pick. Okay. So A, you need to know A, the thymus, and E, the spleen. Okay. So you need to know which is lymph. Sometimes you can know the name and you get the arrow wrong. That's another thing. All right. So you need to be very careful. Okay. They are asking you which of these structures collects. Let me show you. Which one? Yes. So the answer is B. All right. That is the lacteals, right? In the intestine. They are just very specialized lymphatic capillaries. Very specialized. Like after you eat a meal, these lacteals absorb dietary fats, and they now package it into particles called what? Chylomicrons. All right. So you need to know this. Extremely important that you know this. Okay. Hold on. Okay, look at this diagram. Last diagram for today, I guess. Somebody just said, thank God. I feel you. Look at this diagram, all right? Is it? Yes. Which letter? Okay, look at the few questions. Somebody said, thank God. Because I know you can be going. So which letter indicates an afferent lymphatic vessel? Which one? Which letter? Please, you cannot be keeping quiet, or you need to be talking fast. Please, I need to leave you guys. I need to leave you and run away, but I don't want to leave you prematurely. All right? Yes, that's B. You can see it's going in. A, all right? Extremely important. So look at this question. Where do B cells differentiate? The answer is B, all right? This one, where do B cells differentiate into plasma cells? Where? Yes, the answer is C. It's called germinal centers, all right? You can see germinal centers in lymph nodes, spleen, even the Peyer's patches. You get it? So those are the places you can see these germinal centers, and that is where maturation of B cells happen. So look at this. Which one indicates medullary cord? Which one? Yes, medullary cord is D. Medullary cord is D. Medullary cord is D. Let me see. Yes, it's D. No. Ah, one final diagram, please. One final diagram. It's says scene. If I don't show you this diagram, look at this diagram. Why is it not pasting? Aha. Look at this diagram. I need it to be on its own. It refused to be on its own, so that's fine. But look at the diagram A, B, C, D, E. You need to know these components. Extremely important. So they will ask you which letter represents NK cells. Remember the function of NK cells, all right? How people will understand the functions of NK cells. So look at this. Which letter represents NK cells here? Okay, to avoid wasting time, NK cell is A, all right? Then they will ask you to also identify macrophage. Macrophage is E. Macrophages is E. They will also identify which chemicals does A represent. Which chemical does A represent? You understand? What is NK says pouring first? It's perforins. So which chemical does A represent? Perforins. They have to perforate. All right. And that is the major questions they're going to ask you. Okay. And that is it. Any question for me? Oh boy, 11. I've tried though. You guys have tried also, honestly, because like today is terrible. This snow is just we spend more than 3 to 4 hours removing snow, you know. This one seems to be worse than the last one, correct? Yes, it's perforin. Yes. This snow is worse than the last snow, correct? It was so bad. Oh Lord, like, yay. A lot of people's guys under the snow right now. When the team becomes strong, I wonder how they're going. I'm telling you, like Blizzard. I wonder how they're going to bring it out. I don't know. It depends on the spirits, Vedet. 24, right? Oh Lord. And I heard that another one is going to come on. Is it Wednesday and Thursday? No, last one was bad, but it was not as bad as this. You're correct. I don't know when the next one is. I heard that there's another one coming during the week. I know all of you are wishing that you should come on Thursday so that you not come to school. It's going to come on Friday. Yeah, I heard it's going to snow again this week. I heard it's going to. Oh, you heard it. Wednesday and Thursday. Until then, Sha, if it's going to slow, that means we'll postpone your exam to next upper week. And we do an in-person class online on Thursday. But that's by the way, you get every information when we finalize the entire thing. Thank you guys so much. I appreciate. Thank you. I appreciate. It was nice having you guys. You guys are on fire this night. I hope they cancel the class. No, they're not going to cancel the class. We'll do the class online, which is fine by me and you. Because if I do class online, I'm always faster than in person. Victor, this is the first time I'm hearing from you. You did not answer any question. I was watching. You did not answer anything. Now you're saying yes. Because they say, I hope they cancel the class. Yes, you support. Chanel. Hey, look at everybody that was sleeping. Now I know people that are sleeping. Yeah, in person, if I take in person, like tomorrow I'm going to take AP1 class in person. Not in person, online class. And it's always very fast. I finish my topic very fast. Say more on Thursday. You don't want to go to school. I laugh. I laugh in Spanish. I laugh in Spanish. They will not cancel the class. Stop hoping. Nobody's going to cancel any class. The only thing that they will say in person, online, and it's fine by me. So if they do online, if they say online, that means you will not write the exam that day, because I don't know how to proctor exam online. I really don't, and I don't have the strength to start. I'll just push it next week. And we just do the next week class this week. Thank you so much. I appreciate. All right, guys. It's nice doing business with you. I'm supposed to have a meeting with my programmers, and I'm already late by 30 minutes. I will just text them and see if they are still available. We are still working on the AI app, on the LearnersCruise. So still tell your friends, all right? Tell everybody. If you do the link, I'll send you the link to your group, or you text me individually. I can easily send you the link. Or even on Facebook, on YouTube here, I can still send you the link. If you have not followed, please try to follow All right, try to subscribe, try to follow as soon as possible. Right now, click the notification bell. Very important, so that anytime I'm handling other classes like pathology, like microbiology, like pharmacology, you'll be notified, and you may need it tomorrow. All right, and also when the app is ready, you will also be notified. Thank you, guys. My professor, you last semester, I sent you a bunch of emails. Have you gotten any of them? Me? You sent me a bunch of emails? Are you in CSI? Or in Helen Fold? Because a lot of people in CSI, you said yes. Is it CSI or Helen Fold? Right. If you say yes, I'm confused because I asked you to CSI. So the problem, let me tell you, you need to go check the email you are sending me. You understand? Check the email. The problem is that a lot of people in CSI are sending me email with that ends in at cix.csi.cuni.edu. That's a student's email. You remember I did my master's in CSI, so I had that email. You see, my student's email. So if you go there, you see a lot of emails. I have 3,000 emails there. I've not opened anyone. So if you want to send me an email, I said that a lot of people in CSI are sending me email at cix.csi.cuni.edu. That's my student email. I have 3,000 email there, and I'm not planning to open it anytime soon. If you want to send me email, send email at that same name at csi.cuni.edu. That's professor's email. In school, the email ends in csi.cuni.edu. But any student ends in CIX first. So that CIX is active. It's my email. So all those bunch you are sending is there that you sent it, because there's no way you would have sent me a bunch of emails and I would have not returned your email. Impossible. You're welcome. So just send me that email. If it's very important, send me that, because I know most of you want recommendation. Yes, I do, but I can't remember it. So just send me an email. All right. Tell me what's up so that we can I can give you a time we talk virtually or in person. CSI, you will see me in CSI by Saturday. A letter of recommendation. Okay, just send me email message about it. I don't need to give you a special, like, we don't need to see. You're right. But if it's very important for you to see me, just come around on Saturday from 9 o'clock to almost 4 o'clock. I'll be in school. All right. Then most times I'm in the lab, but you can't meet me in the lab. So it has to be in class. 9 to 4. You understand? On Saturdays. All right. So thank you so much. See you guys later. Have a nice night. Bye-bye. I'm going to log off now. We've tried. How do I log off again? Okay. End stream. Hope you subscribe, everybody. Yeah. Bye-bye.